So Delphinus was a non-randomized study, phase 1-2 study, which recruited pediatric and young adult patients up to the age of 30 with first relapse of T-ALL or T-lymphoblastic lymphoma, who historically have had a very poor outcome with less than 20% cure rates. And the question we were asking was, can the addition of Daratumumab to induction consolidation improve the remission rate at the end of induction, which was the primary endpoint, and then the secondary endpoints were the proportion of patients who achieved a good enough response to benefit from transplant and their 1-year event-free and overall survival and relapse rates. And on the primary endpoint, the study did not meet its outcome endpoint, which was 60% CR rate, but the overall response rate, particularly in patients who went on to receive Daratumumab for consolidation, was better than historical controls, and the depth of response was also better than historical controls, such that the proportion of patients who could go on to transplant and the event-free survival, the overall survival rate was better than historical control. So the conclusion was that Daratumumab may have efficacy in T-ALL such that we are now planning to test it in the first-line setting for patients who are MRD positive at the end of induction.